You're pregnant and you've been told you've got preeclampsia. It sounds serious and it can be scary. I'm Zainab, I'm the pharmacist from PillSorted. It's when you have high blood pressure and you have protein in your urine. In a normal pregnancy, the blood vessels that connect to the placenta are quite wide open and help deliver a good flow of blood. With preeclampsia, these blood vessels are actually quite narrow and your body can't give efficient blood flow to the placenta. Your body compensates it by bringing up your blood pressure. So if we don't manage preeclampsia well, it can affect both the mother and the baby, and it can affect a couple of organs in the mother, so their liver, their kidney and their blood clotting systems. High risk for preeclampsia are high blood pressure already before pregnancy, if you have had preeclampsia during previous pregnancies, and type 1 or type 2 diabetes or kidney problems. There are other risk factors as well that are considered moderate risk factors. If you're over 40, if your BMI is quite high, and if you've got a family history of preeclampsia, or if you've got more than one baby at once. If you have one high risk or you have two or more of the moderate risks, you'd be put on aspirin. A low dose of aspirin is one of the safest medications out there, and it drastically decreases the risk. Now, what are the signs and symptoms? Usually with the blood pressure checks that we usually do, with the checks of protein in your urine, those are the times that we can detect it much faster. So you might not have much of a symptom. Sometimes you do have symptoms that can be headaches or blurry vision, swelling in your hands and your face. Now, if you have any of those risks, or if you've been diagnosed already for preeclampsia, you might be told that you need to deliver the baby sooner than week 40 as well, so around week 37 to 38, because the only actual cure for preeclampsia is actually birth and the removal of the placenta. Now, after birth and recovery, an important thing to remember is having preeclampsia during pregnancy is one of the risk factors for heart disease and heart conditions later on in life. Maintaining a healthy weight becomes much more important, because the same risk factors that create the risk for preeclampsia are the same that happen when you're overweight and you have a higher BMI. The other thing is, if you have had a preeclampsia in one pregnancy, you will have a higher risk that it happens again on the second pregnancies. Be careful, you'll be put under more assessments and you'll be offered aspirin from much sooner, from week 12, and you'll be monitored more carefully. This video is part of our pregnancy series videos. Visit our website and reach out to us for that clinician-led safe advice. Thank you.